Unmasking Retraumatization, Truths in Exposure Therapy. Exposure therapy is a well-established and empirically supported treatment for anxiety disorders, including post-traumatic stress disorder, PTSD. Numerous studies have demonstrated the effectiveness of exposure therapy in reducing symptoms and improving overall functioning. While concerns about retraumatization have been raised, empirical evidence generally suggests that when exposure therapy is conducted with careful planning, pacing, and collaboration with the client, it is not inherently traumatizing. Empirical evidence supporting exposure therapy. Randomized controlled trials. A meta-analysis by Powers et al., 2010, examined 35 randomized controlled trials of exposure therapy for various anxiety disorders and found strong evidence for its effectiveness. A study by Bradley et al., 2005, specifically investigated exposure therapy for PTSD and reported significant reductions in symptoms. Long-term follow-up. Follow-up studies have shown that the positive effects of exposure therapy are often maintained over time. For example, a study by Rothbaum et al., 2012, demonstrated the durability of treatment gains for PTSD up to 5 years post-treatment. Comparative effectiveness. Comparative studies have demonstrated that exposure therapy is as effective, if not more effective, than other therapeutic approaches for anxiety disorders. A study by Foa et al., 2005, compared exposure therapy to stress inoculation training for PTSD and found superior outcomes for exposure therapy. Concerns about retraumatization. Misunderstandings and myths. Concerns about retraumatization often stem from misunderstandings or myths about exposure therapy. Exposure does not involve reliving the trauma. Instead, it focuses on facing and processing memories in a therapeutic context. Lack of generalization. Some concerns may arise when exposure is not well structured or does not facilitate generalization to real-life situations. Effective exposure involves systematically confronting feared stimuli to promote desensitization and reduce avoidance. Therapist expertise. The competence of the therapist plays a crucial role. A well-trained therapist understands the importance of pacing, consent, and collaboration in exposure therapy. Incompetent or poorly executed exposure can potentially lead to distress. Therapist expectation and perceived retraumatization. The therapist's expectation of retraumatization can influence the therapeutic process. If a therapist holds strong beliefs that exposure will lead to harm, they may inadvertently communicate their fears to the client, impacting the therapeutic relationship and the client's willingness to engage in exposure exercises. However, this aspect is complex and context-dependent. Research by Krask et al., 2008, suggests that therapists' beliefs about exposure therapy are indeed related to treatment adherence and outcomes. Therapists with more positive beliefs about exposure reported better treatment adherence and outcomes. This underscores the importance of therapists' confidence in the efficacy and safety of exposure therapy. In conclusion, while concerns about retraumatization exist, empirical evidence generally supports the safety and efficacy of exposure therapy when conducted by competent and well-trained therapists. Addressing therapist expectations and fostering a collaborative therapeutic relationship are crucial aspects of ensuring the success of exposure-based interventions. Ongoing research and clinical experience contribute to refining and optimizing exposure therapy protocols. This video is intended for educational purposes only and in no way is intended to offer psychological, legal, or medical services. If you seek help for mental or emotional issues, please seek the services of a licensed mental health professional.